Hey, how's it going? Today I want to showcase a super specialized application of swarms that we've been building called Radiology Swarm. Basically, how it works is the mission is to essentially very rapidly accelerate the time in which it takes to diagnose any type of X-rays and get a full, like, comprehensive, super accurate diagnosis, and then also get a treatment plan associated with that diagnosis using agents. And so basically here, the architecture is we have a well, first you give it a task and an image, and then essentially what happens is it goes to the image analyst, which will analyze the image. Then we have a radiological diagnostician. Then we have another agent, an intervention planner agent, and then we have a quality assurance specialist, and then we have a consolidated diagnosis. All those diagnoses from all those agents get compacted, and then we go to a treatment specialist. Now, the treatment specialist's purpose is kind of to provide like a treatment plan for the patient. Um, and then the output is a analysis of the diagnosis and also the treatment plan. And so basically, the agents, what they do is the image analyst will basically analyze the image. The radiological diagnostician will basically find different ways of diagnosing what type of radiological sub niche that the X-ray falls upon. Like, is it skull? Is it kidneys? Is it things of that nature? Then we have a differential diagnosis development, critical finding identification, and etc. Then we also have an intervention planner, which provides image guided procedure planning, risk assessment, and yeah. The next stage in quality assurance specialist provides technical parameter validation, protocol adherence verification, radiation safety monitoring. Then the clinical integrator provides a clinical radiological correlation, care team communication, follow-up coordination. And then finally, we have the treatment specialist, comprehensive treatment planning, multimodal therapy coordination, response monitoring protocols. So I've turned this into a simple pip package that you can install, and it's super easy to use. You basically just like, it's like what is it? Maybe 3 lines of code. You just import this, then you run this. So analyze this image and provide an analysis and a treatment. You can make this much more specific. You can even say like what type of patient it is, and yeah. So I'll be running the code shortly, but I want to get this installation process complete. So you pip install this, right? And then you have your configuration. So you put your OpenAI key. Then you also put your workspace directory. Actually, the model name is not real. The agent that made this hallucinated, but I'll go ahead and delete that. So you only need 2 keys. You need OpenAI, and then you need your workspace directory. And yeah, so basically, to get started with this, you just make a new folder, you pip install it, and so you go pip. You just pip install that. I'll make it bigger so you can see. So you install it, then you can either you could git clone it as well, or you can just pip install. I recommend pip install because it's radically simpler. And then here we have the files. So yeah, so let's get started. And so here we have the main code that I was showcasing, and here we have an X-ray, but I want to find an example X-ray from the internet to show you how it works. So say X-ray of broken skull, or you can give it your own data, of course. If you work at a hospital, I would suggest giving it that type of data. And we could use this image here. So So you say broken skull X-ray. So now we have a JPEG. So it takes in JPEGs. We're also adding in more features to convert other data formats such as DCM, I believe. And yeah. So here we have, we're going to give it broken skull X-ray JPEG. And so yeah, basically you can say make the prompt more precise and grammatic. Correct. Cursor is amazing. You could have cursor fix prompts pretty easily, and yeah. So you can say you could also give it a file. So you can say broken skull X-ray analysis, and then we have some other parameters. So you can give it a folder in which to output the results in. You can also give it patient info. If you wanted like a little bit more detailed logging. And so basically this is it. 7 lines of code. You can analyze x-rays super fast, super cheaply, at like 1/1000th the cost of an actual radiologist, and more precise. So if we run this, we're going to see the agents working together. And then we're going to get the output document that I showed you earlier. So if we run that, we'll be seeing the agents work together pretty soon. So they should be running. Yep. So this is the flow. We have 4 agents. The diagnosis agents, and then we'll get the treatment specialist agent. So this is the first agent. Okay. Positioning lateral view of the skull, adequate for evaluating cranial primary findings. Significant of the full, notably significant fracture. The fracture lines are complex and involve multiple segments. The press fan can potentially impinge on intricate, requiring detailed evaluation on axial or scheduled planes. No evident midline shift, but a full axial CT review is necessary to rule out the intracranial hemorrhage or edema. And yeah, so this is the second agent. This is the radiological diagnostician. It's saying significant fractures of skull noted in the parietal appear extending to the frontal bone. Fracture lines appear complex, and yeah. Immediate action, neurological assessment, immediate comprehensive examination to rule out traumatic brain injury. Consider CT or MRI to closely evaluate potential brain injury, focusing on brain structures. Surgical intervention, consult with neurosurgery for possible intervention due to complexity and depression of the fracture. And then finally, we have the treatments. We have the 2 agents that run after that, and then finally, we have the treatment specialist. So image analyst, modality, CT, technical quality, primary findings, fracture details. Significant fracture observed in the left parietal region extending into the frontal bone. The fracture is complex, involving multiple segments. Depressed fracture fragments are present, potentially impacting intracranial structures. Additional observations, no evident midline shift, but further axial CT review is advised to rule out the intracranial hemorrhage. Then we have some more diagnosticians. Treatment plan. Neurological assessment. Conduct an immediate comprehensive neurological examination to rule out traumatic brain injury. Repeat imaging. Consider further CT or MRI imaging to assess any potential brain injury with a focus on intracranial structures. Surgical intervention. Neurosurgical consultation. Consult with neurosurgery to the complexity and depression of the fracture. Surgical intervention may be necessary to elevate depressed segments to prevent intracranial pressure or brain compression. Monitoring and support. Inpatient monitoring, continual observation for signs of increased intracranial pressure, pain management, follow-up plan, serial imaging, rehabilitation, and safety and considerations. And then the final output is the JSON. So it gives you an analysis ID, gives you all the diagnose reports. It gives you the type of image metadata, the request, task, image path, priority, routine, patient info, and yeah, and then you get our recommendations, which is the output of the treatment specialist agent. And yeah, this is kind of like a full like API ready JSON output. So the plan is to well, essentially make this local for now, and then have an API that's free that radiologists and doctors and healthcare data providers can use to access the swarm. And of course, we're going to be making it better by providing more data input types, and also specializing the prompts so they're much better. And yeah, here we have priority, output file types, and then we should have a report in the reports folder. So we do. We have a report here. This is the output of the treatment specialist agents as a document, and then yeah, you can see this. You could also make this a PDF if you want. Like, you can make this much larger, and then you can also customize the agents here. So here are all the agents. So this is the specialist agents. You can also say like something like, ensure your outputs are extremely lengthy and provide an extremely detailed and extensive report covering various possible treatment plans. Then you can also specify the max tokens to be like 16,000, which I think that the max output is 16,000 now. And yeah. So this is the agents code. If you go to the Swarm wrapper, this is where all the agents are basically located. All the agents we talked about before. We have 1, 2, 3, 4. We have 5 agents in total here. And we're using GPT-4 Vision, and then GPT-4o for the visual processing. And now we can run another one. So we can say X-ray JPEG, first X-ray analysis. So now we can run it again on this first image that we had earlier, which is not as damaged as the first image. So we're going to run that, and we're going to have a whole new analysis for the first image. And then we're going to run that again. The agents are running in the flow. They're running sequentially, agent after agent. And then we have the first result here. Primary finding presence of distinct or radiolucent line, possible fracture, indicated by the arrow over the right parietal bone. Localization, right of the bone. No obvious intracranial displacement of bone. Sinuses, mastoid cells, and remaining bones appear. No calcified liaisons or other cranial abnormalities. Comparison with prior studies. If available, comparison with previous x-rays or CT scans would be beneficial to assess changes over time or post-treatment evaluations. For any neurological symptoms such as increased eye and pain management, analgesics is required. Further imaging, CT scan. Recommend for a detailed assessment of the fracture extent. Then we have the second agents, third agents, fourth agents, and then we have a extremely comprehensive radiological treatment plan. And then it outputs to JSON, as I said earlier. And so this is API ready, production ready. And then we can check to see our reports section, and then we could have the analysis of the treatment plan. Suggestion of a fracture, right side of the skull. No evidence of intracranial air displacement of bone fractures, bone fragments, or acute hemorrhage. Indications the sinuses of mastoid air cells appear intact. Treatment plan. observation, initiate close monitoring for any new or worsening neurological symptoms such as headache, confusion, or signs of increased intracranial pressure. Pain management, administer anesthetics as needed for symptom control, CT scan, neurological consultation, follow-up neurological monitoring, follow-up imaging, long-term strategy, follow-up imaging, scheduled treatment modification triggers, long-term monitoring, and then additional considerations. And so yeah, this is probably like the first ever super specialized swarm of radiological agents, and the plan is to assist radiologists in analyzing deformities and any possible complications within any form of radiological data, super fast and super cheap. And for the next steps, we have a to-do list here. If you want to contribute to this, we'd love to have you. For example, I want to add support for DCM and other data types. Implement multimodal RAG for image processing, maybe ChromaDB if it works with images now. And yeah, there's a lot of other features we can add, but if you like this application and you find it useful, please check out the Swarm's GitHub and please star fork and share it with friends. It is, as of now, the most capable agent framework on the planet, and not too many people know about it. So and also check out the Radiological Swarm. I'll provide the links below, of course, and that's here. But yeah, if you enjoyed this video, please like, subscribe, hit the notifications bell, and please share your thoughts in the comments, how we can improve this, how we can make it better. And also join the Swarm's Discord community. We have nearly 9,000 people in our Discord. And if you have any questions, any requests for support, you can always ask me or the team, and we'll be right there with you 24/7. So thank you for your time, and have a good day.